Error executing tool function. Sara Novak had been at Hartwell Veterans Medical Center for 22 days. 22 days of being handed the rooms no one else wanted. 22 days of residents calling her the quiet one, like that was an insult. 22 days of keeping her head down, because she had learned a long time ago, in places that never appeared on any public map, that the people who talk the loudest are rarely the ones worth listening to. Welcome to Quiet Badge's Stories. If you've been here before, you already know we tell the stories of the people who do the most and say the least. If you're new, hit that subscribe button, drop a like, and tell me in the comments where you're listening from tonight. I want to know how far this one travels. Now let's get into it. Sandra Voss ran the charge desk at Hartwell the way certain people run small kingdoms. She had the badge, the seniority, and the particular cruelty that comes from confusing institutional power with actual worth. She tapped her pen on the desk once, twice, and smiled at the group of nurses gathered near the medication cart. Room 7, she said. Staff Sergeant Owen Grady, Army Ranger, retired, blast injury, vocal cords gone, can't speak, won't write, won't cooperate. Flagged combative by 3 separate staff members this week. Nick Teller, a second-year resident with the confidence of someone who had never been wrong about anything important, leaned against the counter. 4th staff members going to have the same experience. Sandra looked at Sara, who was standing at the edge of the group, holding a chart she had already memorized. Parker, Sandra said, getting the name wrong on purpose. Sara didn't correct her. You handle difficult patients, right? That's what your file says. Novak, Sara said, and yes. Perfect. Sandra was already turning away. Room 7, vitals, pain assessment, breathing treatment if he tolerates it. Don't waste anyone's time with drama. Nick raised his phone just high enough that Sara could see the screen was recording. Someone near the printer laughed into their coffee. Sara picked up the chart and walked. Owen Grady, 41, retired staff sergeant, 75th Ranger Regiment. Blast injury Kandahar 11 years prior. Traumatic laryngeal fracture, 2 surgical repairs, no functional voice production remaining. Admitted after collapse during an outpatient rehabilitation appointment. Fever, elevated heart rate, left-sided chest pain, labs pending. Red flagged, uncooperative, combative, non-compliant. Sara hated those flags. In her experience, they almost always meant the same thing. Someone had stopped trying to understand a person, then blamed the person for the resulting silence. The hallway at Hartwell smelled the way all VA hospitals smelled. Cleaning solution and old coffee and the specific weight of years of waiting. Veterans lined the corridor in wheelchairs, some sleeping, some watching the ceiling with the flat eyes of men who had learned patience by surviving things that should have killed them. A few glanced at Sara as she passed. One old man, a Korea-era Marine with a face like cracked leather, watched her hands as she adjusted her chart. She didn't know why, not yet. She stopped outside room 7 and looked through the narrow window. Owen Grady sat with his back against the wall, not the headboard. His knees were bent. His eyes moved from the door to the window to the call button to the emergency oxygen port mounted on the wall. He wasn't being difficult. He was doing what every man trained the way he'd been trained did when he woke up in an unfamiliar room full of strangers who didn't speak his language. He was mapping the space. 2 orderlies stood inside near the door. One held a tablet with large printed text on the screen. Write your answer here. The other held a whiteboard with a dry erase marker attached by a string. Owen was looking at neither of them. Sara knocked twice on the frame, open-handed, knuckles flat, the way you knock when you want someone to know you aren't hiding what your hands are doing. Owen's eyes went to her hands immediately. She pushed the door open slowly and kept her palms visible. You 2 can go, she said to the orderlies. We were told to stay. I'm releasing you. Her voice was quiet. Thank you. They left faster than they should have, which told her everything about how the last 20 minutes had gone. Sara didn't approach the bed. She stood near the door, set her chart on the windowsill, and pulled a small spiral-bound notepad and pen from her pocket. She wrote 2 lines and held the pad up so Owen could read it without her taking a single step toward him. My name is Sara. I am your nurse. I will not touch you without asking first. Owen stared at it. His expression didn't change, but his shoulders moved. Just slightly, the way a man's shoulders move when he lets out a breath he'd been holding longer than he realized. He held up one hand. Wait. She waited. She noticed he kept things within reach, always, and produced a small laminated card covered in typed categories. Pain, hunger, bathroom, location. Yes, no, stop. The card was worn soft at the edges. Someone had made it for him a long time ago, and he'd carried it because no one at this hospital had thought to ask if he already had his own system. He tapped the card, then looked at her. She read it carefully, then wrote, Got it. Your system or mine, doesn't matter, works. The corner of his mouth shifted, not a smile, just the release of something that had been clenched. He wrote on the whiteboard the orderlies had left, fast, clean letters. How long until they send someone else? Sara wrote, not if you're okay with me staying. He studied her for a long moment. His eyes were the pale gray of winter sky, and they moved over her the way trained eyes move over anything that matters. Not rudely, but thoroughly, the way you read a room before you trust it. How taught you to knock like that? Sara tilted her head, like what? Hands open, slow. She wrote, someone patient. He wrote, lie. She almost smiled. She wrote, may I check your vitals? He held up one finger, question first, underlined twice. Go ahead. What did they tell you about me? She didn't soften it. She wrote exactly what Sandra had said, combative, difficult, non-compliant. He stared at the notepad. Then you? She wrote, I think you've been in a room full of people who didn't know how to talk to you and assumed the problem was you. Owen set down his marker. He looked at the wall for 3 full seconds, then nodded once, short and deliberate, and held out his left arm for the blood pressure cuff. She took every vital herself. No machine shortcuts, no cold stethoscope pressed without warning. Temperature first with a quiet tap on his forearm to signal before she moved. Blood pressure 162/97. Pulse 118. Oxygen 94%. Temperature 101.2. She counted his respirations without telling him she was doing it. 31 per minute. Too fast. She wrote, can I listen to your chest? And waited for his nod before she listened. Left side clear, right lower field diminished. Not absent, but wrong. Owen wrote while she worked. They said anxiety. She wrote back, when did the chest pain start? Last night, worse this morning. Worse after you walked in from transport? Much worse. She stepped back and looked at him carefully. His right hand had settled against his lower ribs without him seeming to notice it. The way people hold injuries without realizing it, the way pain becomes normal. She wrote, I need to get a physician. I'll be right back, and underlined, I'll be right back. He wrote, they won't come. She wrote, they will. He wrote, they'll say anxiety. She wrote, they're about to be wrong. She walked to the nurse's station where Sandra was updating a schedule and Nick Teller was finishing a coffee. She handed Sandra the written vitals. Room 7 needs Dr. Ashford. Fever, tachycardia, pulse 118, diminished right lower breath sounds, pain since last night. Nick set down his coffee. He's been like that since admission. He's been deteriorating since admission. There's a difference. Dr. Brent Ashford arrived with the energy of someone interrupted from something more important. Tall, well-dressed in the way of a man who thought about how he looked, with the kind of face that had never had to work hard for anything, because it had opened the right doors from the start. He glanced at Owen through the window, then at Sara. He's refused examination twice today. He didn't refuse. He had no interpreter and no communication support, and he stopped trusting the process. Those are different things. Ashford's expression didn't change. Pain score and anxiety response. Order a breathing treatment, document the refusals, I'll sign the note. His right lower breath sounds are diminished. Novak. He said her name like a word he didn't think mattered. You've been here 3 weeks. I've been doing this for 11 years. Order the treatment. Sara looked at him for a moment, just long enough to let him know she'd heard exactly what he said, and was choosing her next action deliberately. She went back to Owen's room. He wrote immediately, told you. She wrote, give me 10 more minutes. His face tightened. He wrote, you believe me. She wrote, your lungs believe you, I'm just the translator. Owen looked at that sentence for a long time. Then something in his face shifted. Not relief, something older than relief. Recognition, maybe. The look of a man who had forgotten something was possible until it happened. His oxygen dropped to 91 while she stood there. She put oxygen tubing on him after he nodded, watched his sat climb slowly to 93, and then watched it stay there when it should have kept climbing. She listened to his chest again. Right lower field, worse, a dullness where air should have been moving. She stepped into the hall and pulled the rapid response cord. The alarm cut through the unit. Ashford came out of the physician workroom still holding his tablet. What did you do? I called rapid response. Her voice was even. His oxygen is 91 on room air, deteriorating. Right lower field diminished on auscultation, left-sided chest pain, fever, tachycardia. This is not anxiety. You do not call rapid response without attending authorization. The protocol doesn't require it. I am telling you. His oxygen is 91, doctor. The rapid response team rounded the corner. Dr. Celia Park from the pulmonary unit arrived first, dark-eyed and fast, with the walk of someone who had learned to read a room before anyone briefed her. What have we got? Sara gave the summary in 30 seconds. Ashford cut in twice. Park didn't look at him either time. She listened to Owen's chest herself, moved the stethoscope through 4 positions, and stood still for a long moment after the last one. Then she looked up. "Get me portable imaging." Ashford cleared his throat. "Celia, this patient has a documented history of right pleural effusion with possible pneumonia, maybe worse." She looked at him. "Anxiety doesn't fill a lung." Owen watched all of it from the bed, his eyes tracking every face, every gesture, every shift in the room, the way a man tracks exits. Sara moved to where he could see her hands and wrote, "They're taking an X-ray now. You were right. I'm sorry it took this long." He wrote, "You believed me." She wrote, "From the beginning." He wrote, "Why?" She wrote, "Because combative usually means frustrated, and frustrated usually means no one listened." Owen looked at that for a moment, then wrote something slowly, in smaller letters than before, letters that looked like they cost him something. "First time in 4 days someone believed me." The X-ray confirmed it. Right lower lobe pneumonia with a moderate parapneumonic effusion. Not anxiety, not non-compliance. An infection that had been building for days while the people around him decided the problem was his personality. Park ordered antibiotics, respiratory therapy, pain management, and a pulmonology consult. All without looking at Ashford, which Sara noticed. The room had shifted the moment someone listened with a stethoscope instead of with assumptions. Ashford recovered the way arrogant people recover, fast, and by redirecting. He caught Sara in the hall once the imaging team had cleared out. "You had no authority to call that response." "He's breathing better." "That is not the point." Sara looked at him. "What is the point, doctor?" He stepped closer. Not close enough to be threatening, close enough to be sure she felt it. "The point is that new nurses who want to keep their jobs in this unit follow the clinical hierarchy. They do not go around attendings. They do not make unilateral decisions. They do not make me look incompetent in front of a response team." She waited until he'd finished. "If his oxygen had dropped to 85 before you ordered imaging," she said, "you'd have looked worse." He walked away without answering. That was its own answer. Nick Teller passed her in the hall. His phone was in his pocket now. He didn't say anything, and his silence was different from Owen's. Owen's silence carried weight. Nick's carried the hollowness of someone who'd wanted to witness something embarrassing and watch something else happen instead. Sara went back to room 7. Owen had the whiteboard on his knees, writing. When she entered, he turned it toward her. Ashford looked mad. She wrote, "He'll survive." Owen wrote, "Will I?" She wrote, "Yes, antibiotics started. You have a real diagnosis now." He wrote, "Because of you." She shook her head and wrote, "Because of you. You kept communicating even when everyone stopped listening." "I just showed up with a notepad." He studied her for a long time after that. His pale gray eyes moved from her face to her hands to the way she stood near the door. Positioned, she realized he'd noticed, so she could see both him and the exit without turning her head. An old habit, not hospital-trained. He wrote slowly, "Where were you before here?" She wrote, "Lots of places." He wrote, "Lie, again." She wrote, "Does it matter?" He wrote something she didn't expect. "You stand like someone who has cleared rooms." Sara looked at that sentence for 3 full seconds. She wrote, "I'm a nurse." He wrote, "You're also something else." She wrote, "Get some rest, I'll check on you in an hour." He wrote, "I'll be here," then, underneath, in smaller letters, "Ren." She went very still. He'd written the word without looking up from the board. Then he glanced at her and wrote, "It's what they called you, a friend told me, small. Gets in and out, everyone forgets to watch the small owns." Sara should have looked confused. Confusion would have been the safe response. Instead, she looked at the word on the whiteboard and felt the specific cold of a door she'd thought was locked being tested from the other side. She took the eraser from the tray and wiped the board clean, then wrote on her notepad, "Who is the friend?" He wrote a name. One name. A name that belonged to a man who had died in the Korangal Valley 9 years ago, in a classified action that had never been made public. A man whose file Sara had signed paperwork to protect the moment she accepted her medical discharge, her new identity, and the understanding that Ren had drowned in a river that didn't exist in any after-action report. She sat down in the chair beside his bed and said nothing for a long moment. Owen wrote, "He said if I ever you were alive, to tell you it wasn't your fault." She looked out the window. The parking lot was gray and flat and ordinary. Cars circled slowly, looking for spaces. The world outside had no idea anything had happened. She wrote, "What are you doing here, Owen?" He wrote, "Same thing as you hiding." She wrote, "What are you hiding from?" He wrote, "I had Hartwell Medical. From the base hospital in Candor, contractors were filing false casualty reports to extend send surface contracts. 15 men hurt worse than the records showed, benefits dented. I was there, I saw the originals." He paused, then wrote, "They'd been looking for me for 3 years." Sara read it twice. She looked at Owen, at the way he braced himself against the wall, at the laminated card worn smooth from years of use, at the scars on his throat no reconstruction had fully hidden, at the eyes that hadn't stopped scanning the room even while they talked. She wrote, "Where are the records now?" He tapped his knee brace. She looked at it. Standard issue rehabilitation support, beige neoprene, nothing remarkable. He held her gaze while she studied it. She wrote, "Does anyone know you have them?" He wrote, "They figured it out." She wrote, "Who is they?" He wrote, "Ask the orderly. Wu came in last night and spent 10 minutes adjusting the oxygen unit without checking my oxygen." Sara's blood went cold. She stood, walked to the oxygen port on the wall, and examined it without touching it. The connection looked standard. But there was a scratch on the housing too clean to be old, and the flow indicator was reading a rate that didn't match the setting. She opened the door and scanned the hall. There, near the end of the corridor, a man in a maintenance uniform she didn't recognize, standing beside the electrical panel with his badge turned face. His shoes were wrong, soft-soled, clean, no scuffs. Not a man who walked these floors every day. She went to the nurse's station. "Sandra, lock the med room, check the oxygen access panels on this ward." Sandra looked up. "Why?" "Because I'm asking you to." Something in Sara's voice made Sandra push back her chair without asking again. Later, she wouldn't be able to explain what it was about that voice. Only that it was the kind of voice that arrives already done arguing. Sara picked up the floor phone and called the pulmonary charge line, "Dr. Park, room 7. Now if you can." She hung up. The overhead speaker crackled, "Code Gray, East Corridor, Code Gray." The hall erupted. A shout came from near radiology. A man in a gray jacket ran for the stairwell. 2 security guards moved to intercept. Sara went back to Owen's room and closed the door, pulling the heavy visitor's chair against the handle. Owen was already sitting up straighter, his laminated card put away, his eyes tracking the door. She wrote fast, "Someone tampered with your oxygen. Possible threat. Security responding." He wrote, "How many?" She wrote, "Counting." He pointed at the window. She moved to it, the parking lot, a white van idling, one man behind the wheel, another moving toward the service entrance at a pace that wasn't a visitor's pace. She wrote, "2 outside, 1 in." He held up his knee brace. She took it and pressed along the inner seam until her fingers found a small firm rectangle sewn into the foam. A thumb drive the size of a fingernail. She looked at him. He wrote, "Get it out of this building." She pocketed it. Then she went to the door and looked through the window. The man in the maintenance uniform was moving toward room 7, his right hand inside his jacket. Park arrived behind him in the hall, adjusting her stethoscope, about to walk directly between him and the door. Sara opened the door and said clearly and without raising her voice, "Dr. Park, step to your left, please." Park stepped left, habit from years of trusting clinical voices. The man in the maintenance jacket reached the doorway and pushed. The chair caught him. He shoved again. Sara hit the door from the inside with her shoulder, planted her feet, reached for the call cord with her other hand, and pulled it hard. The alarm screamed through the ward. Owen ripped the blood pressure cable's heavy metal wall mount free and held it in both hands. Even sitting in a hospital bed with a chest infection, an IV line, and 11 years of accumulated damage, he looked exactly like what he was. The door gave. The man in the maintenance jacket stumbled through, and Sara had his wrist before he cleared the frame. Elbow locked, body weight redirected, his own momentum turned against him in a controlled fall that put him face down on the tile with her knee in his shoulder, and no dramatic noise whatsoever. His badge fell. It read Hartwell Faculties Managed, but the font was 2 sizes smaller than every real badge Sara had seen in 3 weeks. Security arrived 40 seconds later. 3 guards stopped in the doorway, staring at the new nurse in blue scrubs standing over a man twice her size, one hand on his wrist, the other held out toward them, palm flat. "Gloves, evidence bag, don't touch the badge with bare hands." The nearest guard had said, "Ma'am." "Find the man by the service entrance, white van, 2nd row, call federal, not local, federal." He moved. Not because he understood all of what was happening, but because some voices have already finished deciding before they speak, and this was one of those voices. Ashford arrived at a run, which surprised Sara. She hadn't expected him to run toward anything. He stopped in the doorway and took in the man on the floor, Owen sitting upright with the cable in his hands, Sara's expression. What happened? Patient assault. Insider access. The oxygen port in this room was tampered with last night, during a visit from an unscheduled orderly. She looked at him, which means he'd been deteriorating longer than this morning, which means the window for treatment was closing. Ashford stared at her. "Which is why it mattered," she said, "that someone caught it." Park appeared behind him. "Federal police are on the line for you." She was looking at Sara. They asked for Ren. The hall went very quiet. Owen wrote on his whiteboard, slow and deliberate, and held it up so the doorway full of people could read it. Sara translated without being asked, because there was no longer a reason not to. She saved my life before and again. Ashford's face moved through several things, landing finally on something that looked almost like shame, though it had further to travel to get there than it should have. The federal agents arrived 40 minutes later through the main entrance. 2 investigators in plain clothes, and behind them a woman in a dark suit who moved with the specific efficiency of someone who'd spent years making the most of rooms that didn't want to give her any space. Silver-streaked hair, a face that had seen enough to stop being surprised without hardening into cruelty. Deputy Director Margot Hess, Joint Operations. She walked into room 7, looked at Owen, looked at Sara, and said, "Sergeant First Class, Sara Novak. Call sign Ren. Classified medical separation, Operation Hollow Ridge, 9 years ago." The hall behind her had gone very still. Sandra stood near the doorway with both hands pressed flat against her own arms. Nick Teller stood beside her, his phone in his pocket where it had stayed for the past hour. Ashford cleared his throat. "Director, I want to be clear that I was the attending physician on this case and—" "Dr. Ashford." Hess didn't look at him. "I'll speak with you after I speak with my people." He stopped. She'd said my people like a fact, not a claim. The room adjusted to it. Owen's monitor began chirping. Sara moved to him automatically. His oxygen had dropped to 90 again, his pulse climbing, his face pale in the way faces go pale when the body has spent too much energy on too many things at once. She repositioned the oxygen, elevated his head, checked the IV line, and wrote, "You did enough. Let the infection do its job of getting better now." He wrote back, "The drive." She pressed her pocket once, just once. He nodded. Hess watched the exchange. "The drive's been logged as federal evidence. Chain of custody is intact." She looked at Sara. "You didn't open it." "Wasn't mine to open." "Correct." She paused. "The man on the floor is subcontracted technically through a shell that traces back to the same procurement office that filed the casualty reports. There are 4 names on those reports. 2 of them draw federal salaries." Owen closed his eyes. "The case is built," Hess said. "Sergeant Grady's testimony closes it." She looked at him. "We need you healthy, Sergeant. That means staying here, treated correctly, for as long as it takes." Owen opened his eyes and looked at Sara. Sara looked around the room, at the whiteboard, clean and erased, at the notepad, at Owen's laminated card tucked into the blanket beside him, at Sandra in the doorway, hands still pressed to her arms, her face showing something not quite remorse yet, but becoming it. She wrote, "You're not alone in this room." Owen read it, looked up, wrote back, "Haven't been, since you knocked." Hess spoke to Sara quietly in the hall while Park managed Owen's care inside. "Your sealed status ends when the warrants move, you understand that." "I know." "We can move you, new placement, full classification." Sara looked through the window at Owen, watching Park with the calm of a man who had decided, for the first time in 4 days, to let someone help him. "No," she said. Hess studied her. "This hospital put you in that room as a joke. I know what they did. And you want to stay." Sara looked at the worn laminated card, already composing in her head a better communication board than the one in the room, one with more categories, built for a man who'd been using the same worn card for years because no one had ever thought to build him a better one. "I want to fix what's broken here," she said. "That's different from wanting anything for myself." Hess was quiet a moment. "You haven't changed." "I don't know if that's a compliment." "It is," Hess said, "in this particular instance." The administrative review happened 2 days later, in a conference room with framed values on the walls and weak coffee on the table. Sara stood, as she always did. Director Halsey of Hartwell Administration sat at the head, Ashford beside him. Sandra sat across from them with her hands folded on the table, not her usual posture. Nick Teller had submitted a voluntary statement the night before. 1 page, very honest, and it had cost him something to write, which Sara knew because he'd knocked on the supply room door while she was restocking, just to tell her he'd done it. "You didn't have to tell me," she'd said. "I recorded patients before, not just you. I don't know what I thought it was." He stopped. "I thought it was training material. I didn't think about them." Sara had looked at him for a long moment. "Keep thinking about them," she said. "From now on, just do that." He'd nodded and walked away. She thought he might actually do it. At the review, Halsey said, "Nurse Novak, we have to address the unauthorized rapid response call. It saved his life." Protocol. Protocol exists to protect patients. If protocol can't be invoked when a patient is in danger, the protocol needs to be reviewed, not the nurse who bypassed it to prevent a death. Ashford opened his mouth. "Hess, invited to attend as federal liaison. Didn't look at him, she didn't need to. Something about her presence made people choose their words more carefully. Halsey shuffled papers. The federal matter complicates this review. The federal matter, Sara said, started with a contractor who knew Sergeant Grady was at this hospital. It continued because inadequate communication support left him isolated and accessible. It almost ended with him dead in a room flagged as housing a difficult patient, which meant fewer people were watching it. The room was quiet. He was not difficult. He was not non-compliant. He was a man with no functional voice who'd been handed a tablet and a whiteboard, and no one willing to sit down and learn how he communicated. He was labeled combative because he was frustrated. He was frustrated because he'd been admitted 4 days prior, and not one person in this building had taken 30 minutes to understand him. She looked at Halsey. That is not a medical failure. That is a failure of attention. Sandra spoke for the first time, her voice quiet. I assigned her to that room because I thought she'd fail. Nobody said anything. I thought it would be, I don't know. I thought the patient was impossible and she was too quiet and it would be something to laugh about. She stopped. I understand what I did. Sara looked at her. She didn't offer comfort quickly. Comfort offered too fast made apology cheap. I need you to do something with that understanding, she said. Anything. Every patient on this ward with a communication barrier gets a trained interpreter, or a communication specialist within 4 hours of admission. Not a tablet propped against a pillow. Not a whiteboard with a dried-up marker. An actual person. Yes. No patient gets flagged, combative, without a documented record of what communication was attempted and what the response was. Yes. No staff member records a patient under any circumstances without their written consent. Sandra glanced at Nick, who was looking at the table. Yes, she said. And Sergeant Grady gets a direct apology from the staff members who documented him as non-compliant without attempting adapted communication. Written, on file. Halsey said, that's somewhat irregular. So is almost dying from a treatable infection while everyone around you decides your silence is the problem. Sara looked at him. He gave 9 years. He lost his voice. He carried evidence of federal fraud for 3 years at personal risk. He deserved better than what this hospital gave him in his first 4 days here. No one argued. Owen went to step down the following week. He was moving better, the antibiotics working, the effusion draining. His color had come back, which made him look younger. More, Sara thought, like the man in the pre-Kandahar photo in his file. Someone who had once laughed easily, who had once taken up more space than injury had allowed him since. He wrote on his whiteboard one morning during rounds, Marjorie in room 9 doesn't speak English. Nobody brought an interpreter yesterday. Sara went to Marjorie's room before finishing her rounds. Sandra had an interpreter on the line within the hour. Owen wrote when Sara told him, see, you're fixing it. She wrote, we're fixing it. He wrote, team. She wrote, don't push it, Sergeant. He wrote, Ren. She turned the notepad face down on the tray table. He wrote, I know you're not going back to wherever they'd send you. She wrote, no. He wrote and underlined, good, this is where the work is. On discharge day, Owen dressed in civilian clothes for the first time since admission. A dark green shirt, worn jeans, the clothes of a man who'd chosen comfort over everything else. He sat in the mandatory discharge wheelchair near the nurse's station. Sandra came to him and handed him a folded letter. He read it, looked at her for a long moment and nodded once. That was enough. Sandra accepted it for the door it was, not the door she hadn't yet earned. Nick Teller stood near radiology. I registered for the communication support training, he told Sara. The one the education department is running. Good. They said it's being developed by someone on staff. He paused. Is it you? It's me and the speech therapy department, and a veteran from room 9 who speaks 4 languages and has opinions about curriculum. Nick almost smiled. Okay. First session is Thursday, Sara said, mandatory for all residents. He nodded and went back to work. Owen stopped his wheelchair at the exit and reached for his notepad. He wrote something and held it up, facing the nurses' station, where Sandra, 2 other nurses, a morning resident, an orderly, and the Korean War veteran from room 6 who'd come to see him off were all standing. In large, clear letters. You thought silence meant weakness. You were wrong. Sara read it aloud because he looked at her and she understood what he was asking. Her voice carried down the hall. Then he wrote underneath and held it up again. She heard me when nobody else tried. That is not a small thing. Do not make it small. She translated. Her voice was steady. She had practice at that. He tucked the notepad away, tapped his chest twice, the old signal, the one that meant seen and understood, and wheeled himself through the doors. Hess was waiting in the parking lot. Owen would give his testimony. The warrants would move. 4 names in a procurement office were about to have a very different year than they'd planned. The drive that had spent one afternoon in Sara's pocket had already changed hands to the people who knew what to do with it. Sara stood at the window and watched the parking lot until the car carrying Owen pulled out and merged into the ordinary traffic of an ordinary morning. Behind her, the ward was already busy again. A phone rang, a monitor chirped, someone asked for the crash cart key. Someone asked for an interpreter for room 11. Sara went to room 11. Her badge still read Sara Novak, RN, no rank, no classification, no call sign. She had decided that was enough, not because the other things weren't real, but because this was where the work was, and the work didn't need her to be anything other than present and paying attention. And in a building full of people who had learned to speak in the many different languages of pain and silence and survival, that turned out to be exactly what was needed.